Chandray Rheumatology and Immunology Center and Research, a center with a difference. Patient awareness talk by our experts in the field of rheumatology, clinical immunology, allergy and reproductive immunology.
Greetings from Chandray Rheumatology and Immunology Center. I am Dr. Chandrasekhar IS, rheumatologist. In next 10 to 15 minutes, I will be discussing about what is pain as a sensation, what is pain as a symptom. Sometimes pain itself becomes a part of the disease or a disease itself, and what exactly we meant by pain. Pain may be a warning sign. Sometimes it also could be a part of the pleasure that we work with. For instance, when you jog, when you work out, when you sweat, we feel it is good. So normally it is one of the things which can generate the pain, but we feel and we work to have that. Even sometime when we do gymnasium or some other activities, we may experience pain, but we still take it as pleasurable. So that's why as late as Joseph Addison in his discussion with pain, he said it's one of sort of a mysterious love, uncertain treasure. It shows, it looks more of a like of a pain, whether it is pain or pleasure. It's always a matter of confusion when we speak about the pain. Pain is one of the fundamental and one of the basic sensation most of the organism have. It occurs as a result of a noxious stimuli. It could be heat, it could be chemical, it could be sometimes a mechanical pressure. All these are converted into a sort of action potential from the receptor, which moves into the spinal cord, and from the spinal cord it touches to the brain, and in the brain in higher center it is perceived as one of the important signal of something going wrong. So the pain usually gives us some input or information about things that are happening on the external surface. Similarly, pain can sometimes also occur as a result of tissue damage. For example, when there is an injury to an internal organ in, say, intestine or skin or on the lungs, and sometimes it is also produced by cells which comes into the place of an injury or where there is an infection. For example, when there is a pus, you know that when there is a pus, you have white cells like neutrophil, mast cell, macrophage, so many white cells which are from the blood enters into that site. They also can trigger these nerve fibers, which in turn also can generate a sort of pain signals. So in a nutshell, pain can come as a result of a abnormal temperature, abnormal pressure, or a cut in the skin, or because of inflammation or tissue damages. All these can produce the pain. So as now we know, the pain is not just always that there is a disease. Pain can come for non-disease purposes like a pressure or temperature or anything, or pain can come because of some of the activities which we have done for our own gain and for our own purpose. So thus we need to look at the pain as something which has two different ends. An activity would have put you onto a pleasure, an activity which would have resulted into the pain. To give a best example, suppose if you play a sports, you play a game, say for example, heavy physical active game like a football or a cricket. Normally a winning team will not suffer from pain for quite some time because they have gained, they have won. And that pleasure, that happiness of winning takes them through whatever the pain or a discomfort that has developed out of their exhausting physical activity, and they continue to not to have pain. On the contrary, a team which has lost the game and which in turn has not done to the victory, usually they start suffering pain here and there because of that physical activity. So mental or emotional thing also influences how you feel the pain. When you have a gain, even the pain could be pleasurable for some time, but when you have lost it or when you are desperate, even the minor things or a minor discomfort can become a pain. So that's why pain, if it is okay, if there is a gain, not pain is taken okay. If you have lost it, pain is not taken as okay, especially if there is no gain. So when you are having a pain, when you experience a pain by yourself, we have a lot of confusion. It's not just for the individual who suffer from the pain. Even sometimes the treating physician or a doctor will also be met with some confusion that should I really treat this pain or not. For example, if someone has a severe stomach pain or abdominal pain or appendix pain, if I treat and mask the pain, sometimes we miss a signal which could otherwise be harmful. Sometimes we try to avoid using heavy pain relievers so that we don't miss the sign or a signal of something which is likely to go wrong. So, but most of the time when the pain is chronic, persistingly troubling them, or it is so distressing and itself causing a problem, we need to treat the pain. Again, how much I should treat the pain? Should I completely eliminate the pain, or should I put the pain, make him absolutely pain free? Again, depends on the condition which is resulting in the pain. Again, in the treating modalities, we have medications to use, we have pain relievers, we have narcotic pain relievers, which are pharmacological things which can help you, or you can use a simple non-pharmacological things like exercise, physiotherapy, etc., which can also help. So pain is not as simple as we think. The pain could be a dangerous signal, or even a subtle pain could be of a dangerous signal. For example, mild discomfort in a chest which is occurring as a part and parcel of an heart disease or an heart attack, it certainly tells of a very serious signal for immediate attention of the medical treatment requirement. Whereas a psychological distress which produces a severe agonizing pain may not be life-threatening. We may not lose the patient even if we don't treat it for a quite long time. But it's always a difficult proposition and always difficult scenario for us to understand whether pain is really need an attention or really can be ignored. So it's a lot of perceptions, and since pain is half a perception, half occurs because of a signal which is happening wrong in the body. So it's always difficult. Should we treat? Should I immediately take an attention to the doctor, or should I really have a visit to the hospital? It is something which we need to decide, use a lot of common sense, and we need to work on that. If a pain which is unusual, not something which you see in your every day-to-day activities, it needs an attention. If you have a chest discomfort which is unusual, which is not something which you experience every day, then it needs an attention. When you work out, the pain that is happening is much more than what it is happening. Stop your workout, hold on, see to the doctor immediately, and there could be something wrong. So basically what happens is, your pain and discomfort, it's sometimes very difficult to ascertain. It's a routine pain, oh, I usually experience this, or it is something pain which needs an immediate attention. So pain needs to be very much analyzed and very nicely analyzed by yourself as well as by the doctor before we take a call whether we need it to be attended or it needs to be ignored. So pain is not as simple as one consider, but it needs, and with an experience and with your common sense, one can take a call whether it needs an attention or whether it doesn't need an attention. So again, how much to manage, how much painkiller I should take, how much I should take the medications to relieve the pain. As long as your pain is not interfering in your day-to-day activity, as long as it is not threatening your life, as long as it is not something which is indicating something which is likely to threaten the life or an organ, you can wait for it. So that's what we call as a severity of the pain and what is the associated problem with the pain. For example, you have an appendicitis, pain is because of appendix, you need to immediately go for an attention. If it is pain because of a muscle cramp or a muscle pain, immediate attention of a medical fraternity may not be required, but you can take analgesics and do some relieving measures, even including a simple massage can help you. So the factor which contributes to your pain and discomfort also makes a matter, and you need to weigh the risk to benefit about taking the treatment and not taking the treatment. So the problem causing pain, especially in a chronic condition, the pain is continuous, persisting. Now we know it's not something which is acutely life-threatening, because if usually heart attack is an acute severe pain, a appendix pain is a first time appearing pain, a new severe serious pain, and a joints pains which are sometimes continuous. You experience it from last 1 month, 2 months, slowly increasing in pain, what we call as a chronic pain. And it can also occur because of many of the problems, like it could be because of a structural damage. It could be because of small tear in the ligament or a small structural problem in the joint, or it could be because of inflammation and arthritis, or because of a neuronal injury or neuropathic pain. Based on the causes for the pain, the treatment differs. Not all pain has to be treated with painkillers. If pain is because of a lack of support or because of structural damage, you just simple bracing and exercise can help you. So pain, especially of a chronic pain, is multifactorial. Many problems causes the pain. One need to figure out what is causing pain, and the treatment and intervention depends on what caused the pain. Just for an example, if it is because of inflammation, we use anti-inflammatory drug, what we call as NSAID or painkiller. In one of our lecture series, they will be dealing about it. If it is a physical damage, say distorted knee, you need to put a bracing that will help you. And if it is a neurological conditions, drugs like pregabalin, etc., can help you in improvising these conditions. So thus, pain management is an art, and a person, the experts in those fields, will be able to figure out what really helps you. So all pain need not be treated with painkillers. The pain reason for the pain is something which is going to decide and determine what is the best way out for these patients. So just to give an example, if a patient has a joints pain with increased ESR and CRP and also has an anti-CCP positive, it is definitely rheumatoid. Here we have to use both DMARD as well as NSAIDs. When pain persists, when CRP, ESR are normal, and the patient is infrequently taking NSAIDs, we need to continue DMARD. Painkiller may not be required. He needs more good active exercise. Maybe if he is depressed or stressed out, need to treat his stress and other conditions which precipitates his pain. So pain management is a dynamic managed process. Not that all pain need to be managed with the painkillers. One need to think what is the result or what is the reason for the cause for pain, and based on that we need to decide and manage this further. Management of pain is both an art and science, so we need to have a detailed history. So it's always best as a patient you give the full information to the doctor, and he will give he may ask you to go through the test and tries to figure out which is the best goal, and so that he can balance between the possible problem with the drugs or medications that's to be given, and also how best you can come out of these pain and pain related troubles. So pain is a required sensation. We need pain. Pain is going to help a lot with reference to survival. There are conditions where we lose pain, especially in diabetics. If we lose a nervous tissue gets damaged, as a result of which we lose the pain sensation in the legs, that itself can result in the damage to the joints. There are conditions where patients don't have, there are young children who are born without pain, and when they are born without pain, because of the absence of pain, they damage or hurt themselves, and that itself causes a lot of problems. So pain is a necessity. Pain is one of the warning signals that we get. Pain is, we call it as a sort of a necessity, and it's a needful devil. So we feel pain, we feel discomfort, but that really gives you an attention that what is causing the pain. Sometimes when you are distressed, disturbed, when you are depressed, even the minor discomfort will become painful. So this is where we need to analyze and make ourselves cope with things. And this sort of problems, what we call as chronic widespread pain syndromes, fibromyalgia, in these conditions, we feel more pain than what they are and what they exist. So pain is something which is not just occurs because of a problem in the body. It can also sometimes occur because you are distressed, you are depressed, or you have a lot of anxiety and pressure and tension. So analyzing the reason for the pain and subsequent appropriate treatment is likely to help. So the month of September is considered as the awareness of the pain. Especially, we want people to be aware that all pain is not always harmful, but pain is one of the warning sign or a warning symptom for us about a possible harm too. So we need to differentiate them and treat them accordingly. Thank you very much for patience hearing.